Depression is basically a state of low mood and reduced activity. The major causes of depression are: number one, abuse. Few medications like antiviral drugs and corticosteroid over a period of time can increase your risk of depression. Conflicts in an individual's life. Another cause is death or loss of someone very near and dear. Genetics. It is also seen that this depression actually runs in the family. So a past family history of depression in generations may again make an individual, or rather it makes an individual prone to develop depression. Serious illnesses. A major serious illness or some chronic disease like chronic diabetes, renal failure, hypertension, heart failure, previous heart attacks. It makes an individual emotionally more liable to have depression. You'll see the first is change in the behavior of an individual. The individual starts relying on alcohol and sedatives. These are the major signs of depression. A person very frequently gets overjoyous. He gets frustrated very easily. He becomes highly irritable and very frequently irritable. The individual starts showing sign of extreme happiness. He becomes extremely unhappy or sad. So these are the common changes, common signs that are present in an individual undergoing depression. His thought process changes. He starts getting these weird thoughts. A person who is depressed, he starts feeling sick. He starts feeling tired all the time. He starts developing muscle pain. He starts developing headache. These are very, very common physical findings in an individual who is undergoing through different phases of depression. The individuals start getting sleep disturbances. There is change in the appetite behavior. Either he starts eating much more than what he used to eat, or there is a complete loss of appetite. As a result, either there is excessive gain of weight or there is extreme loss of weight in a short time. First is major depression or major depressive disorder. The second is dysthymic disorder. That is another form of depression. Another important type of depressive form is bipolar disorder. It's also known as maniac depressive psychosis. Missed work days, refraining from work, decreased productivity, emotional and psychological disturbances. Other effects are fatigue, loss of concentration, always keeping low, leading to chronic health related problems. Number one is psychological therapy. In psychological therapy, it can be further classified as CBT or cognitive behavior thinking. The next form of psychological therapy is interpersonal therapy. Besides psychological therapy, there is medication therapy. Other forms of supports are equally effective, like support from family members, friends. A good diet forms a very important part. Then e-therapies. It works as effective as a face-to-face psychological counseling. Certain relaxation techniques like yogas are also found to be effective in cases of depression. So overall we need to know that depression is not something which cannot be taken care of once the cause of depression is taken care of. And once you recognize the cause of depression, it is not very difficult to get rid of it or to get out of it. Thank you.